My name is Colin Cantwell. I'm from St. Vincent's University Hospital in Dublin. So bleeding into organs and bowel is a common emergency in hospitals. Many of these patients are very sick and are referred for CT angiography in order to detect if they are actively bleeding, to localize that bleeding within the body, or to detect the cause of bleeding, whether it be a colonic tumor or a torn vessel. On the basis of that CT angiography, a lot of these patients come to interventional radiology to have conventional angiography and embolization treatments. There is a diagnostic dilemma and a therapeutic dilemma for patients who have negative CT angiography tests. And that's the cohort or group of patients that we look at retrospectively in this paper. So for intensive care medicine doctors, surgical and medical doctors who are caring for these patients who are hemodynamically unstable with low blood pressure or high heart rates, and if they have a negative CT bleeding study, they should know that they can talk to an interventional radiologist who, having looked at this data, will know that in this group of patients, if they have a negative CT angio, that if you perform conventional angiography, approximately 57% of these patients will have the option to have a therapeutic treatment with embolization, which may be life-saving. The second note is for urologists specifically, that when we looked at the source of the bleeding and which organ they were bleeding from, in the terms of the kidney, 36% of these patients who had active bleeding had a negative CT angiography test, and therefore in patients with bleeding from kidneys, they should have angiography and embolization at an earlier stage if they remain sick with a low blood pressure or heart rate. So the ultimate benefit for patients is that despite having negative tests, their doctors will be armed with the data to know, when we looked retrospectively at 170 patients, some of these patients who had negative CT angiography tests should have an interventional radiology therapy or treatment, because it may be life-saving.